Hello, we're here with Alain, CEO from Yposkesi. Alain, hello, can you just introduce yourself for me, please?
Yeah, so I'm Alain Lamproye, I'm the Chief Executive Officer of Yposkesi.
Thank you, it's a pleasure to have you here. When is the construction of the second plant expected to be completed, and when will it begin the CDMO operation?
So we are actually expanding our manufacturing facility for the production of viral vectors. The construction is ongoing. Construction will be completed in Q1 next year, followed with qualification and validation studies. So we should be operational by the end of next year, beginning of 2024.
Amazing, lots to look forward to. So how will the second plant boost Yposkesi's market competitiveness?
So this second plan is very important for Yposkesi because this plan is about large-scale manufacturing of commercial batches. And so that's very important for Yposkesi to support its customers from the very early phase up to the commercial phase. So for us, very important, this complete, I would say, our service offering.
For the second plant, do you already have deals in place, or are there talks with global pharmaceutical companies right now?
Actually, we have roughly 20 projects ongoing, some of which really may end up in this new manufacturing plan. All depends actually on the success of the clinical trials. Hopefully they will be successful, and hence, yes, we will have operation and manufacturing for those projects and customers.
Well, we'll keep our fingers crossed for you. The entire world, regardless of industries, have been struggling with supply chains taking a hit from the pandemic and conflict between Russia and Ukraine. What are the obstacles that Yposkesi is facing now?
Obviously, the pandemics and more recently the war in Ukraine have put a lot of pressure of supply chain. And so we do have some challenges, obviously, one of the most critical being the supply of one critical raw material called plasmids. We have actual strategies in place in dual sourcing those plasmids, and this is where it's very important for us. This is where the CBM, the Center of Breakthrough Medicine, which is part actually of the SK pharmteco family, is very important because we're going to supply plasmids from CBM very, very soon.
SK pharmteco has invested in CBM early this year. How do you plan to develop the partnership with CBM?
Lot of opportunities for us both to work together. I mentioned the plasmid supply, but I can also mention many other topics and fields. For example, cell therapy, where CBM has a lot and significant capacities for cell therapy manufacturing, whereas Yposkesi has strengths and skills in the manufacturing of viral vectors. So that's a very good combination of our respective services.
A great combination indeed. So it might be too early to discuss any future expansions plans as the second plant is still under construction, but the global cell and gene therapy market will continue to expand. So what are the mid to long term projects of Yposkesi?
Good question. We do have the possibility to further expand our operations, and especially the construction, the large-scale manufacturing plan, which is actually under construction, can be expanded. So we have designed this plan to be further expanded. Now, the question, the timing, I don't have an answer immediately, but yes, I would say that in the coming maybe 2 to 3 years, we'll be talking about expansion. Yeah.
That's amazing. We're excited to see that. Alain, thank you so much for talking to us. It's been a pleasure.
Thank you very much. Thank you very much.